Good morning, Midwest Breast Warriors. It's Dr. Tawari here. I'm in between cases. I'm about to start a deep flap reconstruction. Dr. Kale is working right now. I thought I'd take a minute and answer a really interesting question that we got to our social media from a patient from Westchester, New York. Mrs. A asked us, how do we plan for our plastic surgeries? And I thought it was a really interesting question that we've never really answered before. And I think that whether we're doing a reconstructive option or we're doing a cosmetic operation, it's sort of the same type of a thought process. We're always thinking about shape and position and symmetry. Many of our patients know we take pictures on all our patients, preoperative pictures, and we will actually sit down and we'll take a look at those pictures before the operation. And what we want to do is we want to match the goals of the patient to the tools that we have in order to get them to their final results, whether it's fat grafting or doing an en bloc operation or doing a deep flap reconstruction or some other type of autologous breast reconstruction. A lot of our preoperative planning is based on the preoperative discussions with patients, and many of our operations are based on communications that Dr. Kale, Dr. Kojak, and I will have. We'll meet once a week and talk about interesting patients, talk about difficult patients, and figure out what is our plan for that patient. So preoperative planning is super critical for any type of surgical procedure. A lot of times for our more complicated reconstructions, we'll do a CT scan, and that helps us figure out a roadmap for the patient's blood vessels. It's a very important part of our preoperative planning. So planning is a critical part of any type of design, and whether we're doing an operation where we're designing a new breast, we're designing a reconstruction, or designing a cosmetic operation, or you're designing something in your home. We all know that if you fail to plan, then you plan to fail. And I think that is definitely true in surgery. So hopefully that was interesting to answer that question from Mrs. A in Westchester, New York. Thank you for sending us that question. I'm going to go back and scrub in. I've got my doc en bloc hat, even though we're not doing an en bloc operation right now. So we'll talk to you soon, and keep those questions coming. Thanks.